Hello and welcome to webinar series hosted by Happiest Health. Happiest Health is a global knowledge platform for health and wellness. I am Kumaran and I will be your host for this session on cancer prevention and lifestyle changes and does it have a connection? The prevalence of cancer in individuals is rising every day. The need of the hour is awareness of prevention methodologies rather than treatment protocols. Lifestyle changes too have a significant contribution in the prevention of cancer. We have with us Dr. Vishal Rao, Country Director, Head Neck Surgical Oncology and Robotic Surgery at HCG Centre, Bengaluru. He's also the Dean, Centre of Academics and Research for HCG Group, who will also throw us light on various aspects of prevention methodology. He has more than 100 national and international publications to his credit, and he's recipient of various awards from state as international bodies such as Kempegowda Award by government and Judy Willenfield Award from Global Tobacco Control by WHO partners. He's also the member consultative group to Principal Scientific Advisory to the Prime Minister of India, Government of India. He's a member of Vision Group for Science, Technology and Biotechnology, Government of Karnataka. He's also the Country Director, IFIA Bharat, International Federation of Investors Association, Healthcare, Science and Technology. We welcome you, Dr. Vishal Rao.
Thank you, Kumaran.
To begin with today's session on, as precisely saying this is a cancer awareness month and how we are bringing up entire cancer awareness to the public rather than talking more on protocols and treatments, I would like to ask you a few questions to share your inputs, Doctor. Firstly, we would talk about your insights on the role of lifestyle factors in cancer prevention and what are some of the significant lifestyle changes people can make to reduce their risk to cancer. Yes.
Sure, Kumaran. Kumaran, in a day-to-day life, in my OPD, one of the first questions asked to me was, I don't drink, I don't smoke, why me? Many of them ask this question, that despite all of this good lifestyle, being meticulous, why am I getting cancers? Now, today, I think what we know beyond a doubt is that cancer is a genetic disease. When I say a genetic disease, I would like to clarify that it is not a hereditary disease. There's a difference between a genetic disease and a hereditary disease. A hereditary disease is something that you get as a genetic dowry, whereas a genetic disease can also be something that you acquire during your lifetime. Now, at this juncture, what we are seeing is the play of the host, the vector, that is the carcinogen, and the environment is playing a very critical role in the concept of One Health, even in non-communicable diseases today. And in some way, if you look at the entire cancer cascade that is happening and the new epidemic, the silent epidemic that is creeping in, it's slowly opening our eyes to a much larger truth that in the coming years, maybe in each family, there will be one cancer patient in the next 1 to 2 decades. And these are the kind of trajectories that global bodies are looking at. So this seems to be entrenched with lifestyle, entrenched. And I think it will contribute to more than 2/3 of the causes.
Okay. Doctor, so when you say that every family member in the future might have one cancer patient, so it's come to a question that does it all matters about our dietary practices? Or can you clarify on food choices? Because people come to you saying that I don't smoke, I don't drink, but still, how did I end up? What are the food choices that can either increase or decrease the cancer risk?
So let's first, if I have to take up the broader umbrella of lifestyle, let's take up 5 or 6 factors that play a very pivotal role.
Okay.
We have tobacco at the top of it, followed by alcohol, followed by that we have air pollution. Then we have diet, nutrition, and food pollution. Then we have obesity. And 6th, we have infections. So these are the 6 spectrums that actually are leading us towards the pathways of cancer as carcinogens. Because this is the 5 or 6 sources we get carcinogens from. Now, if you look at each one of these, I think they have their independent identity in the world of carcinogenesis. tobacco, alcohol are well known. But lesser known ones that we don't discuss today are, for example, air quality. Air quality today is depleting.
Yeah.
Every city, if you look at air quality, it's going beyond 100. The PM 2.5 is skyrocketing,
Yeah.
which is because of building construction, industrialization, and motor vehicles, primarily contributing to it. And in addition to this, we having concrete jungles, lesser trees, and the environmental impact of this is such that, on one side we have the ozone depleting on the outer zone, and suddenly ozone increasing in the inner zone, which is poisonous. It's one among the 4 or 5 key pollutants which is poisonous
Mm.
and carcinogenous and injurious to the lung. So while we are talking about this spectrum, we are talking about, coming towards diet, but what I
Okay.
wanted
Yeah.
to
Yeah.
just bring
Yeah.
up is that
Absolutely.
we've got tobacco, which is also a part of the diet and nutrition today that people take. We have alcohol. We've got the environment in which we live in, the air we breathe in, which is also a part of the consumption for us, because every food that we eat needs to be combusted and metabolized by air and oxygen. And we are not getting the purest form of it today. Our breathing patterns have become poor. We don't even breathe well. And that's another contributory reason. In addition to that, like I said, the ultraviolet index of our country overall is rising. Today, we've seen the tsunami form water, we've seen the earthquakes. The coming days, the worry is about seeing the tsunami from the sun, the glares from the sun, because WHO and UN say that the ultraviolet index can be up to 11. We've seen cities like Bangalore reach 13,
Yeah. Yeah.
which is beyond the safety limit. So ultraviolet index is also rising. And then slowly moving towards food, diet, nutrition, and what its impact is on obesity and exercise.
Yeah.
So
Yeah.
now if you look at it, these are interconnected topics. Diet having the center stage for it. When I say diet, it is different from nutrition. We all have a diet which is for our palate, and nutrition is a separate ball game. Now, what we do in our diet today is we consume things which are almost 3 times excess to what we actually would have generally consumed.
Mhm.
So whenever people ask me about the debate on cancer and why is it rising, I sometimes tell them let's take a broader outlook and let's look at what the society is changing to today.
Okay.
Somewhere we are changing towards an unlimited, instant, and a more society. Correct? We are looking at unlimited food where our
Yeah.
body's needs are very limited.
Yeah.
Looking at we are looking at instant coffee, instant burger, instant pizza, instant love, instant marriage, instant divorce, instant. It's become the trick of the game. You look at more. We're moving towards buy one get three free, and that's the kind of mindset that is setting up in a society when vulture capitalism takes over.
Yeah.
I think post COVID has taught us to move towards a conscious capitalistic approach where value and wealth have to make a meaning.
Yeah.
Otherwise, we are going to create and tumble and create diseases. We are in the process of today inventing new diseases and then inventing cures
Yeah.
in the
Absolutely.
capitalistic world. So, food plays a pivotal role. And in that, if you look at the quality of food that we have today and the food adultery, many of the times, if you look at the UNIDO report, a lot of our export rejects we are among the top export rejects also in food because of the quality of food, the carcinogens, the adulterants, the chemicals added, and this has become a part of the worry from farm to plate.
Great. Yeah.
So I think what everybody as an audience needs to today relook into their own lifestyle is it has to be customized to their own lifestyle. To
Right.
looking at the concept of farm to plate on how am I protecting this particular intake, customized to my body weight, customized to my body mass index, and based on my overall needs. And how do I metabolize it by burning it out, preventing what we call obesity and moreover visceral fat.
Okay.
Subcutaneous fat is still okay, but I use the adage saying that if you are fit, does not mean you are healthy. It's a wrong concept to say that I'm fit, that's why I'm healthy. It's a wrong concept. If you are fit, need not be that you're healthy. And that's where diet and nutrition have to play a key role. And in this, the components of proteins, vitamins, minerals, fibers are very, very crucial. And last comes fats and then carbohydrates. Whereas we've switched the game and given the top rung to carbohydrates and then to fats, which is where the sugar driven industry is running towards it.
Mm-hmm. Fine. When we talk about the sugar industry running into the fight, we also recently also spoke about even salt is something that leads to diabetes. Even as you said about the adultery makes a lot of difference. While we make this entire food choices, doctor, then on the other side, there is also something on physical activity. Maybe after COVID or before COVID, what was the physical activity level amongst the people? And is it a very big risk in developing cancer?
See, physical activity is one of the most important game changers today.
Okay.
And it's a double-edged sword, physical activity. When I do this out of let's start with by saying that today sitting is the new smoking.
Yeah.
Me and you are sitting. Now, if I come in my car, take a lift, sit in this chair, and then work for the day, and then again go back to the lift, go back to my car, go back to my sleep, I think that's my first smoking habit that I've initiated without doing active smoking.
Okay.
So let's put it as simple as that.
Yeah.
That sitting is the new smoking, and physical activity is a non-negotiable item in health.
Yeah.
The olden days, the physical activity would compensate for the calories that we were taking in. So today we've tripled our calories and halved our physical activity. And that is why we will double the death rates.
Okay. So if you could say that, then what are the guidelines on type and amount of exercise that would be beneficial? Because hitting the gyms, doing cardios, doing strengthening, is that the way to prevent cancer? Or what kind of physical activity one can get into?
See, broadly, I would say that when we say physical activity, we are talking about a active physical life where
Right.
sometimes, like for example, a doctor like me may not get 45 minutes to go to the gym and do a
Yeah.
full cardio or something,
Yeah.
but I do utilize this time for at least keeping 20 minutes to half an hour for active physical activities. We have today good amount of fitness gadgets that can give you an idea about the total number of steps, whether it's a 10,000 step or a 20,000 step mark, and balance it with your calories. So, which means that if you are in the vulnerable zone, first of all, have a consultation with a good nutritionalist and possibly a physical therapist to discuss about what's the balance required.
Okay.
Because if you're in the imbalance zone, you need a proper consultation.
Right.
Before we overdo this, okay, and then after that comes the aspect of desirable for muscle building and then taking up additional proteins or supplements which are going to induce muscle growth for you. So what we need to very carefully look here is, again, as I said earlier, fitness does not mean healthiness. And if you're fit doesn't mean you're healthy. And there are classic examples today of people who have lost their lives in the gym.
Yes. Yes.
So the fact remains that no, gymming may further induce, because if your body is under severe biological oxidative stress, by overexerting yourself, you are just increasing the number of increasing the stress to the cardiac system, which is not capable of handling it. So what you need to understand today is, how is it that I can look at fitness? Because this fitness equally, that means for the amount of calories that I consume, I also equally burn it regularly by physical activity, by not overexerting myself and stressing myself, which means a balance of good exercise, a balance of good sleep would be important to balance good nutrition.
Yeah. Yeah. Right.
And this has to be customized to every formula.
Okay. Doctor, see, only recently in the early 2023 is when American Heart Association included sleep as one of their categories that for a good heart health. When it comes to sleep as well, we also had few reports in the Western countries saying that lack of sleep is also a carcinogen. So how do you describe this connection between stress, sleep, and to cancer?
So, on the contrary, a lot of reports have debated on this to say that sleep may not be a full fledged carcinogen, but may
Yeah.
have a profound effect on the immune system, depleting it,
Okay.
which is a standing fact that
Okay.
today, in the presence of carcinogens that I live, that means the air that I breathe, the food that I eat, the physical activity that I do, if it is in imbalance with my sleep, which actually is the harbinger of the autonomous nervous system. And this
Mm-hmm.
is where some new reports have come on something called as heart rate variability, which is actually an indirect measure of your immune system.
Mm-hmm.
Now, a lot of wearables today give you your heart rate variability. That is a predictor of your immune system. And sleep is being monitored actively by these gadgets. A good sleep is essential for what we call autophagy and immune senescence, and for the immune system to get active, because it's during the sleep that your immune system is doing majority of the work. So it is essential, prudent for us to create this ecosystem and plan and ensure that we are able to give a good, decent amount of sleep of a minimum 6 to 8 hours for the body based on your physical activity and your work, to ensure that not only quantity but also the quality of the sleep is equally important.
Right. Right. Doctor, so when we talk about the quality of the sleep, so what are the ways that you could suggest the viewers about managing their stress levels and sleep?
First of all, what I tell our viewers is I had written an op-ed sometime back on stress as a healer,
Okay.
because everybody would come and tell me about this beautiful magical world called stress.
Yeah.
And I was telling them, look, as doctors, imagine for the last 2.5 years what our life has been in COVID. I mean, I'm telling you, I was maybe among the better off. There were people I saw in a much worse conditions, in the ICU teams, in the pulmonology teams, the physicians. Everyone had their share. What difficulties we have faced as a medical fraternity in the COVID times could have been the pinnacle of stress. But
Okay.
what I tell them is there is something called as eustress, the positive stress, and there's something called as the bad stress. Now, don't mix the two, because stress by itself has certain positive effects on your immune system, helps you perform better, optimizes your immune system, and helps you achieve better. Because without stress, maybe you will slack up and the immune system will slow down.
Yeah.
So don't put the word stress under a blanket umbrella which is misquoted and then gets a bad name, because stress is very useful in many ways. But when you take stress to a certain level of extremes, wherein it starts kind of giving you dissatisfaction. So we always say in a very simple word in psychology that the E by the A,
Yeah.
this equation of E by A is your expectation from life and your acceptance of life. This decides your stress quotient.
Yeah. Yeah.
So the higher your expectation from life and the lower the acceptance, the higher the stress level for you, because you are always distressed about more, unlimited, you're unhappy, you're all the time distressed, and happiness factor and your emotional quotient are very closely interlinked. So
Mhm.
that's where your stress quotient and your spiritual quotient can be, and your emotional quotient can be connected. Because what I've constantly seen is in the worst of our times during COVID, many people used to ask us what would be a cardiac status. Doctors are having heart attacks, things are going bad, and we were also doing our checks. But to our thing was, how do we manage this stress in a positive way? And that's what I want to leave our viewers thinking, that stress is not always bad. Please don't give it a bad name. And I don't want every single person walking into a doctor's OPD saying, look, I'm stressed. Because stress is a part of life in today's urban life.
Yeah.
Kumaran,
Yeah.
I'm sure me and you, when we discussed on the phone, we've been talking about how stressful life has been. The
True.
general lighter
True.
note.
True.
But that doesn't mean we're talking about both being depressed and saying frustrated of life. We're talking about it in a joyful way, about being occupied and being at the edge of life many times, achieving goals, correct?
Probably
And I
the
would say,
connotation of stress is misconstrued. Probably the
absolutely.
very yeah. Yeah.
And I think as happy as hell, one of the best messages you can give about use stress is that, look, don't use stress as a bad word.
Yeah.
Stress has positive connotations to it. And let's look at how do we optimize your expectations and your acceptance, because the higher level of your expectation but the lower your acceptance, your stress levels will be skyrocketing, because
Right.
it'll imbalance your emotional quotient and your spiritual quotient. Forget
Yeah.
about your intelligent quotient.
Yeah.
Whereas the higher the acceptance and the lesser the expectation, the better is your overall capability of a stress quotient, the happiness index, your emotional quotient.
Right.
And that's why it will have a very multiplicity positive effect on your immune system.
Hmm.
And these are simple things, not only for a cancer patient, but also for preventing cancers, also for having a good lifestyle that a
Right.
person in today's modern era could adopt. And that itself could be your meditation mantra for mindfulness.
Yeah. Yeah. True. Thank you, Doctor. Rightly put with the stress and how entire sleep quality also affects. The other thing that most importantly when we talk about cancer is about the smoking and alcohol and the connection to it to cancer. But what is your advice for people who are struggling to quit these habits? What resources are available to them?
So today, the debate around quitting smoking is a very funny one,
Okay.
because nicotine is the most powerful addictive agent, more stronger than heroin. So drugs like heroin are strong, it's stronger than that. And that's the power of nicotine. And the tobacco industry knows it very well. If today, every year, 10 lakh people die of cigarette smoking or tobacco use in any other form, chewing or BD or cigarette smoking, the tobacco industry requires 10 lakh more people every year to replenish the loss, to keep the business going. And these 10 lakh people come from children, youngsters. So their entire marketing strategy is around youth. So if you look at most people who are smokers, they start very young, because that's when you can start a habit. You can't start a habit at our age. And that the tobacco industry knows. So all of their marketing strategies are around youth, to try and glamorize youth, to try
Yeah.
and glamorize smoking. So I was seeing this movie in which a detective, if he has to get an idea, had to smoke. A
Yeah.
woman had to express her sexuality, she had to take a fag. A lot of the time, surrogate marketing is often the best way that the industry uses to create positive impressions in your head about smoking to youngsters. And tobacco has 6,000 chemicals, 70 carcinogens: formaldehyde, nickel, chromium, cadmium, radioactive plutonium, benzopyrenes, formaldehydes. Name them, all of them are added into it to
Hmm.
increase the nicotine delivery, and equally harmful for health. Now, once you start this habit, nicotine takes over. And it's not then about your willpower. I keep sometimes saying that will's power sometimes can overcome the willpower. So your nicotine addiction is stronger.
Hmm.
And in such instances, your willpower may not be enough. You may need help. So do not hesitate to take help. But for
Okay.
those who say that I am hesitating to take help, look, there are good programs in quitting, like the Allen Care program. There are books by Allen Care. I'm one of the advisors to the Allen Care program.
Mm.
I found it to be a very easy, simple way to help people quit smoking, which talks, and it's the only program in the world which I've seen which allows you to smoke while you're quitting smoking.
Okay. Uh-huh.
So
Okay.
it is a program that is focused on why you should why do you smoke rather than why you should quit.
Okay.
Remember, every smoker wants to quit, every smoker does not want to smoke, and every smoker knows why he needs to quit. So if you are one enlightened person who wants to eat his head and tell him why he should quit, he's already heard it.
Yeah. Yeah. True.
The way you need to approach this question is to understand, why do you smoke and what are the trigger points and how do we address it.
Mm.
And the two simplest things that I have found is, which I keep telling every smoker, people whom I've interacted with, to say that, look, when they ask me this question, simple is, your urge to smoke also comes from your urge to breathe. So the
Okay.
simplest thing that you could do is, you like this and you take a deep fag and you take that deep breath. That's like your smoking yoga, correct?
Mm. Yeah.
Instead of that, take a good deep breath. That's a good yoga technique to take good oxygen into your lung and replace the need for the carbon monoxide and various other smokes that you're infusing into your lungs.
Mm.
Oxygen itself is a good replacement for the bad smoke that you're taking into your lung.
Okay. Right. Uh,
Second is taking plenty of water when you have the urge to smoke. Both of these are two simple, ready-made quick techniques, and then after that, naturally following a structured program, meeting a psychologist, handholding yourself, and trying to quit this thing. There are also of the on nicotine patches and other
Yeah.
short-term solutions that are available to help you improve your willpower.
Right. Doctor, so while we talked about entire prevention and lifestyle connection, one last question that I wanted to ask you was how important is early detection in the successful treatment of cancer? But though people have prevented so much, they've exercised, their stress levels, sleep, dietary choice, everything is done. But even then, they have cancer. And what is the early detection and how is it helpful for our treatment?
So today we divide prevention into two parts: primary prevention and secondary prevention. The primary prevention focuses on policy, lifestyle
Yeah.
changes, and some of the very fundamental tenets of why cancer happens, which is what we discussed now. We have now moving towards secondary prevention or early detection, which is also a very powerful tool. In fact, it's such a powerful tool that it could replace what I would say any new drug discovery that is happening today is being spent billions of dollars. You could actually make lesser efforts, for example, in oral cancer by simply opening your mouth.
Yeah.
If you are a high risk person who consumes tobacco and alcohol and have anything suspicious in your mouth, by going to your dentist, physician, or ENT, by just simply doing that than by doing any other complicated test and delaying it. So early detection can simply switch the game from stage 4 to stage 1 and simply jump the outcome from a 40% survival in 5 years to an 80% survival.
Okay.
So that's how powerful it is, which no drug can do. So
Yeah.
I think India has to have a priority on early detection. The general public awareness about having that if there is a symptom that is persisting in me for more than a month,
Mm-hmm.
and if I have certain risk factors, I should go and get myself checked, not with an oncologist, but with a physician to rule out a chronic disease. I would
Okay.
reiterate not cancer, but a chronic disease.
Chronic disease. Yeah.
One among the chronic diseases is cancer. So do not
Yeah.
keep it shelved, but do address it and see that you need to meet a physician to discuss this.
Okay. Thank you so much, Doctor. On the last note, on Cancer Awareness Month, what do you believe is the most crucial message or information that you wanted to share to the viewers?
You know, my latest passionate burning topic has been the WHO's cervical cancer elimination program.
Okay.
Today, we are just coming out of a pandemic from one virus, while there is a silent epidemic of the cervical cancer that is increasing and killing women every day. At this juncture in India, I think it should become a priority. Cervical cancer is among the only non-communicable diseases cancer that can be eliminated fully through vaccination and through early detection and screening. So WHO has created this formula of 90, 70, 90. Vaccinate 90 people, screen at least 70 of them, and treat 90 of those people in that percentile. Now, it's important for us to see that this is something possible, feasible. It requires political will. It requires the entire ecosystem of NGOs and health systems to garner together. And we need to, as India, move from maternal and child health to women health. And I
Okay.
think this is one thing that is achievable today. And for rural India, for urban India, this is something that we should gift as a part of cancer prevention to the next generation.
Right. Okay. Thank you so much, Doctor. Thank you
Thank
for
you.
giving us an entire overview on cancer prevention and how lifestyle matters. This is Dr. Vishal Rao, Country Director, Head Neck Surgical Oncology and Robotic Surgery at HCG Cancer Centre. Thank you so much.
Thank you, Kumar.